Public Health Changemakers is a program we rolled out this year. We offered $750 as part of a mini grant to students. They actually had to submit their ideas via a proposal, complete with a budget justification. This is actually being run as a way to have our students get, real-world training and learning about the community and what it takes to essentially create a project through a grant and what the grant process is really like.
Hello, everybody. Welcome to Voices of Wellness podcast with me, your host, Franz Judea Samuel.
I'm so grateful to be selected among the 20 awardees for this opportunity, PH Changemakers. The project that I have and will be implementing is about podcasts and also one community talk. So the goal of this project is to raise awareness about the importance of knowing that it's not always only physical wellness. We have like 9 dimensions of wellness.
I have been given a chance to be awarded for the project called Memphis as one of the awarded projects in PH Care Changemakers. The Memphis is a home-centered digital tool that wants to support families who have children with ADHD.
So this is the workflow of the app and then what it looks like in the future.
My Changemakers project was mostly based off of my field of work. So I work in sickle cell disease. So I have been wanting to do community-based participatory research within sickle cell disease here in Memphis. And one of those aspects of sickle cell disease that gets talked about but not really focused on is mental health. So the focus of my project was to build a mental health coalition for sickle cell disease here in Memphis.
I did a toolkit for my deliverable, I guess you would call it. And so on it, it has 2 QR codes. One of them is a map to the AEDs that are on campus. And then the other one is a link to a hands-only CPR video. My Changemakers project is about AED coverage on campus. I took the 4-minute city model and I kind of tried to adapt it to like a 4-minute campus, was like my pitch.
Y hoy les voy a hablar sobre qué es VIH.
My project focusing on creating a bridgeway towards infectious diseases and education. So I centered that on Salúdame podcast, which is the name. And I saw that there was a need for social media resources. And I really wanted to become more involved in my community. And I believe that this project really has helped me.
The Dance for Life major aim is to help the people, older adults, to be more active, physically active too. But my intention is more mental than physical. The design and the routine we will be deliberating, the choreography we will be deliberating will be more focused on how to strengthen their mental well-being and cognitive health.
I think Changemakers is one of the more forward and innovative attempts I've seen at giving students a direct applied experience of taking an idea and building it to fruition, whether that's a research endeavor, community outreach, community-based research, or just general education, and giving them the opportunity to apply some of their theoretical knowledge that they picked up during their time in the program.
What was the question that I was really kind of seeking to answer? What kind of care can improve Black mothers' childbirth experience? Right? First of all, the framework pushed me to, hold that accountability for managing projects. But I think most importantly, it really built the capacity for me to put myself into that workforce, right? And so using the funds, I was able to support majority of the costs for getting my birth doula training.
PH Changemakers provided me the platform. They provided me the money to implement my ideas into the real life, and they provided me guidance whenever needed.
I feel like Changemakers was a very good thing that was introduced in the School of Public Health, and I'm really grateful that they did this because it has really helped me.
The school public health, the board, the staffs, my fellow students, they are all trying to help me to see that I get into this dream.
Through the Changemakers initiative, what they've really been able to give me is not only connections and the resources to create this event in the first place, but really it's allowed me to have the foundation for the first point of the Memphis Health Jamboree, and that is the soft launch, which will be May 6, 2026.
My topic is Healthy Baby, Healthy Mother. I'm trying to create a virtual social support circle for pregnant women and postnatal women above the age of 18.
This project gave me the chance to directly connect with the community and also learn more about the challenges, the public health challenges in Shelby County, where I learned that we do have high rate of infant mortality and maternal mortality. So this was a nice opportunity for me to connect directly with the people and do something practical for the community.
With Changemakers, we are actively engaged with the community, working alongside with the community to build a better and healthier tomorrow.